The Ebola outbreak started in Guinea and spilled over the Sierra Leone border in the eastern part of Sierra Leone. Then the infection spread to Kenema because we were taking people from Kailaun to come to Kenema for a holding center and a treatment center. It moved to the north, Bombali district, Tonkolili district. It spread to the south, coming to Bo, hitting Moyamba, and then it came in to the central part and moved to Freetown. This was the first time that Ebola moved from a rural setting to an urban setting. Because we were not prepared, both as a country and as health workers, it went out of control. The response to the Ebola outbreak was not limited to the Ministry of Health and Sanitation. The President came up with a state of emergency and the National Emergency Response Center was created. We had a communications pillar which was responsible for awareness raising. With all the interventions, the communication aspect, meaning community engagement, was one of the main factors that turned the war against Ebola. And of course, we had infection prevention and control measures, which were also improved in the various health facilities. IPC was lacking to a certain extent. There were no available gloves. People were still treating people without using gloves. Hand washing techniques was also an issue. So there was a massive drive to improve on the capacity of the health staff to respond, meaning they were trained now specifically to detect, to prevent, and respond to any infections within the health facility. The other part of the response was surveillance. We had cross-border surveillance and we had community-based surveillance. With regards to the post-Ebola response, so it was a multi-sectoral approach. It was within the Office of the President. So we had the presidential recovery priorities. For health, we had specific areas of priorities. Looking at infection prevention and control was still a priority of the Ministry of Health. IPC within each and every health facility, meaning people were still trained on IPC practices. We had WASH, wherein we had international organizations coming in to help. And also, we looked at the Community Health Workers Program. So a national strategic plan for community health workers was developed. All community health workers, about 15,000 of them, were trained. And also survivor care. It was given to the Ministry of Health and Sanitation to take care of the health needs of survivors and provide psychosocial support. And also the Ministry of Social Welfare, Gender and Children Affairs tasked with reintegration into their communities and reconstruction of their livelihoods. That's how CPS, the Comprehensive Program for Ebola Survivors, came into being. An infection and prevention control program was created within the Ministry of Health to oversee IPC activities. There was a training of health workers for IPC. So that's going forward in prevent the spread of any infectious disease, not only Ebola, but looking at cholera, looking at typhoid and all of that. Looking at WASH, water and sanitation, within all health facilities. There are certain minimum requirements that each and every health facility should have. Running water. There should be water in each and every health facility. And there's tremendous improvement in that area. A lot of health facilities now do have running water. Also, electricity is also another must. With regards to survivor care, remember, this was the first time that we had the largest cohorts of survivors. All health workers, 228 initially, were trained on how to provide care in designated health facilities that were in close proximity where we had the highest concentration of survivors. Remember, survivors had a plethora of complications that were reported among them. They had uveitis, they had joint pains, they had headaches, they had suicidal tendencies. The needs of the survivor is nothing new to the general population. The training that was done, capacity building, in terms of providing care to survivors can be used for the general population. And then we established a network of care for survivors, meaning we had survivors themselves who were trained as survivor advocates. We created a parallel structure at that time with an ultimate aim of transitioning over to the CHW program. So these survivor advocates were trained on going into the community, recognize red flags, and report to their survivor advocate supervisors who report to the in charges of the health facilities. We have the referral coordinators within the district, hospitals, and the tertiary hospitals that coordinate the referral process from the communities to the facilities, who were initially put to take care of survivors, but they were not limited to survivors. They are also responsible for others within the free healthcare category. We had a clinical training officer whom we called roving ambassadors, who were also tasked with an improved or continuous medical updates of the education of the healthcare workers. There are a lot of things I think that should have been done differently. The post-Ebola recovery plan should be a more comprehensive document wherein the various facets of the response should be clearly delineated and policy and guidelines clearly structured to guide the response to any future outbreak. Looking at the structure within the district health management teams, there should have been more coordination in terms of providing care to survivors, because to a certain extent, it's only in the recent past with the transition process that they were brought on board to actually supervise the structure that was put in place in terms of the clinical training officers and the referral coordinators. With regards to the post-Ebola response, there are a lot of gaps. One, there was a gap in surveillance, and community-based surveillance also was an issue. That's one thing I would advise to any country that have the preparedness to focus on capacity building and training. That would be key. Another gap that we had in Sierra Leone, and still is a problem, is the case management pillar. Most of the people who are managing our treatment units were experts. We still have to train a cadre of people who could manage cases within the districts, because as a result of the lack of knowledge and fear, a lot of patients died. So case management is still a gray area. Communications also. Remember, we have developed some guidelines, but these guidelines are not yet within the peripheral health units. Policy and guidelines of responding to future outbreaks. That is what will prepare our people to respond to an outbreak. Logistics. If there is a current outbreak right now, there are not even ambulances within the district that would start conveying patients. The infrastructure is still not there. In the post-recovery phase, there are certain key themes that we focus on. One would be awareness raising. Even after an outbreak, knowledge brings power and knowledge brings change. The second thing is infection prevention and control measures. There should be clear-cut policy and guidelines wherein will guide your infection prevention control measures within your health facilities and also at community levels. WASH practices within your communities and also surveillance. There are several vertical programs within the Ministry of Health, and that was clearly depicted the weakness in our health system, because our health system collapsed when Ebola hit, because there are all of these vertical programs with not a proper bedrock upon which you all rest. So health system strength is the bedrock upon which all of these vertical programs should rest upon. Coordination. Everyone should ensure that you have a proper coordination mechanism to ensure the multi-sectoral approach yields the dividend. Everyone has to come on board, not only the Ministry of Health. The second thing in terms of the response, always ensure you have a proper activity tracker of where you are, because that's what helped us in our recovery phase. Having an activity tracker and looking at your priorities and look of how your activities are going, look at your key performance indicators. One thing I will always tell any country to always ensure that in the aftermath of an outbreak, to have support groups, because you have these people who have been affected by these outbreaks and they need support. Finally, ensure strengthening your health system, because that ultimately, if your health system is weak, no matter what you do, your health system would collapse.